Welcome everyone. I want to welcome you on behalf of CanCOVID to our speaker series, our Tuesday speaker series. I'm very excited about today's topic, online fitness. I will, without further ado, hand it over to Dr. Stephen Grover from McGill. Dr. Grover, please go ahead.
Thank you very much, Kimberly. It's a real pleasure to give you guys a very quick overview of what we've been doing during the pandemic. I'm going to start off with just a quick little video of last week's, sort of press release and effort to recruit patients. As you're going to see, recruitment is one of our major challenges at all times, and we're constantly looking for a way to engage people. As you're going to see, we didn't start this project as something that was pandemic related. We sort of got into it in the back door, but without further ado, I haven't got a lot of time to present to you. So let me just give you this 45-second video, and then I'll describe to you how did I get involved in this sort of thing.
Most of us are born with very little body fat. It's true for our children, and it's true for our dogs. Unfortunately, with additional years, we tend to pack on additional pounds. Despite all of the encouragement we receive from family and friends, many of us have been getting less exercise during the past 6 months and have put on a few extra pounds. The Drop 5 mission was created for you. It's a wonderful way to get out more frequently and to lose any extra pounds gained during the past 6 months. What have you got to lose? The Drop 5 mission is free and fun for both of you. You know your dog will love it, even if neither of you loses a single pound.
So let me just stop that there, and I'm going to switch over now to a couple of slides that we have.
Most of us are born thin with very little excess body weight.
You may ask yourself, how did I ever get involved in something like that video? Can you hear me okay?
Yes, I can.
Okay, great. So basically, that video is a call to action for people who've gained weight during the pandemic. And if you've been following the literature, there's more and more reports now coming out of what people are calling CanCOVID pounds, pandemic pounds. And one of the things that was interesting is a Washington Post story a couple of weeks ago announced that people's dogs were gaining weight as well. So we already knew from some of the other challenges we had online in the last couple of months that people loved exercising with their dogs, and we used that angle to try and get dog owners to join the mission. So this is called the Drop 5 mission. I'm going to run through it very quickly. I don't want to spend too much time on it. It's just getting started, but I would mention to any of you who are interested in trying this, it's freely available. This is all being paid for by Veterans Affairs Canada, and we were very fortunate to be able to open it up to Canadians. Over 2/3 of Canadian adults are typically carrying extra pounds, and their physical and mental health suffers as a result. And during the COVID pandemic, we've been gaining weight due to poor eating habits, less exercise, increased stress, and poor sleep. Once the social isolation started, 30% of Canadians have reported that they've gained weight. And if self-report for this type of survey is similar to other surveys, the numbers are probably bigger than that. People tend to underestimate weight gain. So we're arguing with Canadians, the sooner they lose the extra pounds, the more likely they are to keep it off. This mission is going to start based on people assessing the potential benefits of their losing weight. And this is an area that my research group was involved in for the last 30 years, estimating the impact of lifestyle modification and changing your cholesterol and blood pressure on your cardiovascular disease risk. And more recently, over the last few years, we got into cardiometabolic risk. And people are typically, when they come to the program and register to participate, they're asked to estimate what the benefits are for them. They'll be asked to put in their height, their weight, their waist circumference, their lipid levels, etc. I'm not going to do this for you, but it's all there on the website. You can try it for yourself. And then most interestingly, they get a chance to play the what if game. for a 45-year-old who has a cardiometabolic, or let's say a 45-year-old who has a cardiometabolic age of someone who's a year older, they get to play around with if they lost some weight, if they increased their physical activity, brought their high blood pressure down, or lowered their cholesterol ratio, how many years of life would they gain? And that's one of the calls to action that we've been using for years. It's not a panacea. It's better than nothing. We've proven in randomized clinical trials it does engage people. But I got into this, sort of online health promotion because I began to realize that just telling people about risks wasn't sufficient. So on this Drop 5 mission, what people are going to be offered the opportunity to do is to spend 10 weeks learning different techniques for losing weight. Most of them are behaviorally focused, things like mindful eating, managing emotions and food cravings, learning how to sleep better, which is very important as a part of your getting out and exercising, et cetera, et cetera. And again, I'd invite anybody who's interested in this. I'm not going to spend time on it. I really want to get to results. It's freely available. It's out there. How did we get into this? Well, we got a nice grant about a year ago from the Veterans and Family Innovation Fund from Veterans Affairs Canada to set up a health promotion program online for veterans. We had a track record in this area because we had done something quite similar for the Department of National Defense about 7-8 years ago out at CFB Halifax as one of our sort of proof of concept projects. And we showed that we could engage active members of the armed forces in all kinds of healthy lifestyle changes and improve mental and physical health. And that was, I think, the key to us managing to secure the funding for the Veterans Affairs program. The Mission VAV program is basically a 5-year research program to evaluate the effectiveness of evidence-based online health promotion, disease prevention, therapeutic and social support through connectivity with veterans and their families. Health challenges typically include physical activity. Physical activity is just about always there. In our experience, physical activity is the low-hanging fruit in Canada. As many of you know, depending on your age group, no more than 5 to 15% of Canadians exercise 30 minutes a day, most days of the week. And the potential benefits of getting people to exercise regularly are just huge. And I'm not an exercise nut, but it improves their sleep, reduces their stress levels. It's a very effective treatment for both preventing and treating depression. There actually are some randomized clinical trials on PTSD and the impact of exercise. Chronic pain, absolutely critical. And the big one for a lot of the veterans as they go back to small town Canada after being 20, 30 years with the armed forces is that there's a lot of social isolation as well. So we had set this program up about 6 months before the pandemic hit. It launched in September of 2019. And we realized if you look at some of these issues, this is actually highly relevant for Canadians who aren't veterans. And that's what gave us the idea in March. Why don't we see if we could open this up to all Canadians? We had excess capacity to take on more people. This is a proof of concept research study that will enroll up to 4,000 participants over the 5 years that we're funded. And we'll evaluate the effectiveness of these digital health type programs. The offerings are going to focus on physical activity, healthy eating, stress management, etc., and deal with issues like elevated stress, depression, sleep, chronic pain, and cardiometabolic risk. So far, we've done stress, we've done cardiometabolic risk, we've done poor sleep, we're working on chronic pain, we're working on diabetes prevention, diabetes remission, and we're very interested in medical cannabis use. And we're hoping that will all be ready for April of 2021. Now, whether we're still doing this for the pandemic, I have absolutely no idea. This has run much longer than I would have anticipated. What we do is pretty simple. It tends to be some sort of baseline evaluation, education, which we're monitoring at all times. And I'm sorry to say we know that the vast majority of people don't read the educational materials we make available to them, and they're very, very short. Engagement through various means, which I'll show you very briefly, and then back to reevaluating and demonstrating to individuals that over the last 6 to 12 weeks, the changes they've made have improved their health. I'll tell you what we've learned are the two biggest drivers, both for the veterans, but also for the Canadian population during the pandemic. One is gamification. Each of the missions typically has a route that's on a map. It could be a route of pirates going around the Caribbean. It could be teams of individuals walking across the country. They stop at different locations. And as you can see, they can see where their team is. And more importantly, they have a leaderboard that's showing them exactly where they are at any one time compared to the other teams. They can also see their own personal stats and whether they're meeting their own objectives in terms of their daily exercise, if that's the focus in that particular challenge. Social connectivity turns out to be really important too. I'm going to quickly show you just a little bit of data that those individuals who are part of a team, and we encourage people to build teams as much as possible so that the team captain is known to everybody. But social connectivity and peer support make a huge difference in terms of outcomes. And the teams have a message board that they can interact with each other on. Team captain can see what everybody's doing. And then they can post messages to the mission board as well, so that they can, you know, diss the other teams, encourage other teams, that sort of thing. More recently, during the pandemic, we found ourselves with lots of medical students who had nothing to do here in Montreal. So we got a whole bunch of volunteers to make themselves available as health coaches, and we trained them for a couple of weeks, teaching them some of the keys to health coaching. And they're now working with many of our participants online. This will be the third mission that we have health coaching as an option for those people who are interested. I'm going to finish off by telling you the biggest problem, the biggest challenge we faced has not been developing the program, which we've been doing for over a decade now. So we were pretty, you know, we had a pretty good set of resources here. Biggest challenge is getting the message out and letting people know this thing is happening. We've gotten a fair amount of great support and press from the McGill Media Group at the university. Also, our hospitals have been helpful. Social media is no panacea. I got to tell you, no matter how much work we put into the social media, you may see 19,000 people were reached during the month of September. But I can tell you, typically, we will reach out with social media and we'll get 100, for every 100 people we get to come to the site, we might get one person to register. And social media can be a lot of work. We do it constantly. We probably have 2 or 3 posts a week. But I have to tell you how disappointing it's been over the last couple of years for us, and not just in this program. Give you a little bit of information here. I was hoping I'd have a lot more data to share with you, but unfortunately the lockdowns that have occurred both at the university and the hospital have made our data analysis a little bit delayed. And as many of you know, Montreal is sort of getting semi-locked down again. We don't take the data because it's personal health data. We don't take it off site. So even when people are working at home, these are data analyses that we have to put on the back burner. But I quickly, over the last 2 days, got some information for you. And this was our family fitness mission, which ended a couple of weeks ago. It started in July. We basically had, sorry, I can't see what it says on this window because we've had about just over 1,000 people registered to date, and the Family Fitness Mission had about 170 people in it. That number, by the way, the N is wrong there. It's a mistake. That's 1,000 people on the website. The Family Fitness Mission was about 170. 75% male, 25% female. Mean age 49.3. You can see the range, age ranges there. This is perhaps the most interesting slide I have to show you today. And that's when you compare the people in the Family Fitness Mission who were part of a team. In other words, a team captain reached out to them and got them to join a team. we had a 76% completion rate at 6 weeks with that group. 24% dropped out. On the other hand, people who came in individually and couldn't form a team but joined one of the in-house teams that we provided, the numbers are just about reversed. We get a 68% dropout rate and a 32% completion rate. So peer support is really, really important in this game. Whether it's something as simple as exercise, it gets much more complicated when you get into the mental health issues, the stress management. These are very personal issues. Privacy issues are big, et cetera, et cetera. So let me finish off with one last slide. This is what we've learned to date. Recruitment is really hard, much tougher than we ever expected, and we've been doing it now for a year. 1,000 people were on track, but we can't get over how hard it's been. And social isolation didn't make it that much easier. Engagement levels are very time dependent. You have a very brief window to get people interested and to keep them going. And the dropout rates in those first few weeks can be absolutely critical to your success. So that's when we think the health coaching is making the biggest difference. I wish I had that data, but I don't have it ready to share with you yet. Regular and social media help a little. By a little, I mean, if the news media picks up on a press release, we can do very well. It's a big hit if, if CTV News or the local radio station or somebody out in Alberta picks up on the story and interviews us. But often we can send out a press release and get absolutely nothing. Gamification helps more. Making things fun and figuring out how to make it fun is really critical, and we spend a lot of time on that and getting feedback from people. But what we're finding makes the biggest difference is peer support. Family members reaching out to each other and to their friends seems to be the thing that's driving participation results. And I'll stop there. I'd be happy to answer any questions you have.
That's great. Thank you so much, Dr. Grover. I found the cardiometabolic website that you referenced earlier, but I'm curious about if people were interested in signing up, what is the website that you would like to point them to?
Oh, I'm sorry. It was at the first, I should have come back to it. MissionVAV.com.
Mission VAV.
Yeah, it stands for Mission Vétéran Actif or Active Veterans. And the Drop 5 mission started last week. That will be one to help people lose weight. It's going to go for 10 weeks. And frankly, you can join anytime you want. You may not win, but you can, I think a lot of people will care more about whether they lost the 5 pounds they want to lose than whether they cross the finish line first. By the way, you don't get any points for losing weight. You only get points for doing the things and practicing the things we're trying to tell you. Losing weight's really tough. We really spend a lot of time reassuring people that, they shouldn't be fussing themselves just because they can't drop a few pounds. What's really important to us is that they enjoy getting out and doing something and connecting with others. And if they don't lose a pound, so be it.
I think I applaud that statement. As somebody who finds it incredibly difficult to lose weight at all whatsoever, let me reassure you. Mark Penny asks, how many of the participants are veterans? So it originated as a veteran project, but.
Good question. At the moment, we've got about 30% veterans, 60% non-veterans. In other words, the media is allowing us to recruit much faster among the non-veterans than the veterans. Our biggest challenge with the veterans is figuring out how to reach them. There's a lot of Facebook pages for various things for veterans. An example would be Green Veterans, which is cannabis users who are veterans. But it's amazing how limited the numbers are in all these sites. So finding a place where you can get to veterans is not easy. We're lucky that the Royal Canadian Legions has joined us on this, and they pretty much promote us every time we do something. And that's probably where we're getting most of the veterans from.
Very fascinating. If anybody wants to ask them their question directly, please feel free to turn your video on and go ahead and do that. But Abhi, Abhi's going to ask it himself. Thanks, Abhi.
Hi, good afternoon. Thanks, Dr. Grover, for a great presentation. Just further to the last question, in terms of your major findings around peer support, gamification, etc., have you had a chance to compare sort of engagement and these kinds of findings between the veterans population and the general population?
Yeah, I wanted to look at that in time for our talk today, but we decided the data was too dirty and we weren't prepared to stick our necks out. The trouble, and it's a great question, the trouble with engagement is you've got to start with completion rates first and foremost. We see probably people will come to the website, they will register, and a third will never get off the ground. In other words, they'll never get started on that mission that's being offered at that moment in time. We probably lose, depending on the mission, we only get about 30 to 50% get across the finish line. In other words, stay with us for the full 6 weeks. Now, it depends on the topic, of course. We haven't had enough data until just this summer where we felt we could start to compare veterans to non-veterans. The numbers were just too small, but finally in that family fitness mission, we finally had, like 70, 80 veterans compared to just over 100 non-veterans. So we're very interested in this issue, but we didn't feel we could answer it today.
Thank you. I don't want to occupy too much time, so I have a follow-up question, but I'll give others a chance to ask questions in case they do.
Great.
By the way, don't hesitate to reach out to me if you have a particular interest in this. I'm happy to discuss this with anybody who has an interest in this and or would be interested in collaborating. We need all the help we can get.
I see Vivek's turned his monitor on. Vivek? Oh, but you're muted.
I'm here. Is that better?
Yep.
Yeah, I hear you.
Really interesting presentation. I remember seeing early on some data, I think from Fitbit, on the levels of decline in activity that they were recording, and it was like massive across, right around the world.
Yeah.
First of all, I'd be interested in whether you have more up-to-date information on what's known about how active Canadians have been, and or inactive they've been, and how that will translate, because with your calculator, like, there's actually an impact essentially on life expectancy as a result of this. Because I think it is important, it's one of our priority areas that's being identified for CanCOVID is to look at the consequences of the public health measures. And sort of the related point, which you touched on, is, and I think an important part of physical activity for many people is the social connections that they form. And so it's almost like a double whammy that if you're not physically active, you're also not getting that social support. So in your work, are you looking at any measures on social connectivity, social supports, loneliness, things like that?
Yes, yeah, those are wonderful questions. Yes, the answer is once we get, we're getting ready to include a loneliness questionnaire amongst the various assessments that are available for people. But again, I need to tell you that in all honesty, I'd say we maybe get 75% of individuals will fill out a baseline assessment, whatever it is we're asking them. And we keep it very short. Ideally, no sets of assessments ever take them more than 5 minutes or so. So let's say we get 70% to fill out the baseline. We only get 50% to fill out the final one at the end of the thing. So we're always looking at a biased sample of individuals who were completers, and no matter what we do to run after the other individuals, we've had absolutely no success getting people who don't want to fill out things. The STEP data is probably the best data because there's 3 ways people can give us that information. One, it'll use the accelerometers on their phones, whether it's an Android or an iPhone. And that's probably where we get our best data from. It will sync with a Fitbit as an example. And we only have a small proportion of Canadians who are using Fitbits on this thing. And we have a very hard time keeping up to speed with all the other digital devices are out there because they keep changing their programming. So we sort of gave up on it for lack of the budget to keep running after this. As far as, I'm sorry, your question was the peer support. People get points not just for exercising, they get points for making contact. They get points for looking on the leaderboard. They get points for posting a message. They get points for reading messages. We often have a mini challenge midway through a lot of these things where we ask people to reflect on what worked for them, whether it was to help them exercise, lose weight, manage their stress, sleep better. And then we let the other participants indicate which of those posts were most meaningful to them. So we're constantly trying to develop a sense of community and people sharing information and what touches the greatest number of our participants. So we're always looking at these sorts of things. We spend a lot of time being frustrated with missing data, of course. It's unlike a clinical trial where you've engaged an individual face-to-face, people either give us the information or they don't. And that's where you need big numbers too, but it doesn't get rid of the bias, the inherent bias of the people who are participating versus those who've, opted out. I think everybody's muted.
They are, myself included.
Yeah.
I was just going to say we have just a couple of minutes if anyone has any other questions that they want to ask. I am curious because you mentioned Fitbit, and I think underlying your last statement is something really important and key to that social connection aspect, that even though Fitbit also engages in gamification and allows you to compete with your friends, it certainly doesn't privilege or offer that level of support network. So you're definitely setting yourself into a different category in terms of the service that you offer. And I really hope that more Canadians will take advantage of it. I think it seems super great. We have just 1 minute left, and I think we'll just end a little bit early today, if that sounds all right with you.
Well, thank you for your time and for being interested in what we're doing. It's a real pleasure meeting all of you.
Absolutely. I wish you the best on the Lose 5 Pound Challenge and getting back into the office so that you can mine your data further to help improve your program. Thank you so much for joining us, and thank you to everyone for their great questions. Have a great afternoon.
Yeah. Stay safe, everyone.